What I am about to tell you may completely change the way you think about something you have probably been eating your entire life. Something most people consider one of the healthiest choices you can make. Something doctors recommend. Something nutritionists praise. Something you might be having for breakfast this very morning without a second thought. And yet, for millions of seniors across the United States, this one fruit, this single innocent-looking food, could be quietly interfering with their heart medications in ways that are not just surprising, but genuinely dangerous. Not in some rare, far-fetched medical scenario. Right now, today, in kitchens all across America. If you are over 60 and you take any kind of heart medication, blood pressure medication, or cholesterol-lowering drug, please do not go anywhere. What you are about to learn is something your doctor may have never explained clearly. Your pharmacist may have mentioned only briefly, and that most seniors simply never connect to what is happening inside their bodies. And that gap in knowledge, that small, seemingly harmless piece of missing information, has sent thousands of older adults to emergency rooms every single year. Not because they did something reckless, not because they ignored obvious warning signs, but because nobody told them the full truth about this fruit and what it can do when it enters your body alongside your daily medications. Welcome to Healthy After 60. The channel built entirely for adults who want honest, clear, trustworthy health information designed specifically for the way our bodies work after 60. If this is your first time here, we are so glad you found us. And if you have been with us for a while, you already know that we never talk down to you. We never hide the uncomfortable truths, and we always put your health first. If that sounds like the kind of channel you want in your life, take a moment right now and hit subscribe and turn on your notifications, because every single week we bring you information that could genuinely make a difference. Now let us talk about this fruit. We are not going to make you wait until the end to find out what it is, because this is too important. The fruit we are talking about is grapefruit. And before you think, oh, I already knew grapefruit was a problem, please keep watching. Because most seniors only know the vague headline. They have heard something, somewhere, that grapefruit and medications do not mix well. But what they have almost never been told is exactly why that happens, which specific medications are affected, what the actual consequences can be inside your body, and most importantly, what the warning signs look like when something has already gone wrong. That is what this video is going to give you today. The complete picture. Not a surface-level warning, a real, thorough, compassionate explanation of something that could protect your heart, your health, and your life. Grapefruit is genuinely beautiful in many ways. It is rich in vitamin C, packed with antioxidants, low in calories, and for decades it has been marketed as a weight loss superfood and a heart-healthy breakfast staple. For people who are not on certain medications, it truly can be a wonderful food. But for a very significant portion of adults over 60, particularly those managing blood pressure, heart rhythm, cholesterol, or blood clotting, grapefruit carries a hidden danger that most people are completely unaware of. And the tricky part is that this danger does not look like an allergic reaction. It does not cause immediate, obvious symptoms in every case. Sometimes it builds quietly over days or weeks. Sometimes it strikes suddenly. And sometimes, by the time a person realizes something is wrong, the medication in their body has already reached a level far beyond what was ever intended. We are going to walk through all of it together. The science behind it, the real stories of seniors who experience this firsthand, the specific medication categories you need to know about, and the practical steps you can take starting today. So stay with us. This is one of those videos you will want to watch all the way through and then share with every person over 60 in your life. Margaret was 71 years old and living a life that most people her age would genuinely envy. She was active, sharp, social, and careful about her health. She walked every morning, attended her church group twice a week, and took her medications exactly as prescribed. Her cardiologist had placed her on a calcium channel blocker called amlodipine about 2 years earlier to manage her blood pressure. And for the most part, things had been going smoothly. Margaret was proud of how seriously she took her health. She read labels. She watched her sodium. She avoided processed foods. And every single morning, without fail, she started her day with what she believed was the perfect heart-healthy breakfast: a bowl of oatmeal and half a fresh grapefruit. For a long time, nothing seemed wrong. But then gradually, Margaret began noticing things that she could not quite explain. She felt dizzy when she stood up from her chair. Her heart seemed to be beating in a way that felt slightly irregular, almost like it was skipping or fluttering. She felt more tired than usual, even on days when she had slept well. She assumed it was just aging. She assumed it was stress. She even assumed it might be something she needed a new medication for. What she never once assumed was that the grapefruit she had been eating faithfully every morning was the thing quietly amplifying her blood pressure medication to dangerous levels inside her body. When Margaret finally mentioned her symptoms to her doctor during a routine check-in, something clicked. Her doctor asked her a simple question: "Are you eating grapefruit?" And that was the moment everything changed. Her doctor explained what most patients are never told clearly enough. Grapefruit contains natural compounds called furanocoumarins, and these compounds do something remarkable and alarming inside the human digestive system. They block a specific enzyme in your gut, an enzyme called CYP3A4, that is responsible for breaking down and metabolizing many common medications. When that enzyme is blocked, your body cannot process the medication the way it is supposed to. Instead of the drug being metabolized normally and gradually, it floods into your bloodstream at a far higher concentration than intended. In effect, a single glass of grapefruit juice, or 1/2 of a fresh grapefruit, can cause your body to absorb 2, 3, or even 5 times the intended dose of certain medications. Think about what that means for a moment. Your doctor carefully calculated the right dose for your body. Your pharmacist filled that prescription with precision. And then, without either of you realizing it, a piece of fruit sitting on your breakfast table quietly overrode all of that. That is not a minor inconvenience. That is a genuine medical concern. Robert was 68 when he first noticed that something was not right. He had been on a statin medication, specifically atorvastatin, for about 3 years to manage his cholesterol after a mild cardiac event that had shaken his family deeply. He had made enormous changes to his lifestyle. He exercised regularly, cut out most red meat, and was genuinely committed to protecting his heart. His wife, wanting to support his health journey, had started buying fresh grapefruit juice from a local farmer's market each week because she had read that it was full of antioxidants and natural compounds good for the heart. Neither of them had any idea what was actually happening. Over the following weeks, Robert began experiencing muscle pain that he could not explain. It started in his thighs, a deep, aching soreness that he initially attributed to his exercise routine. But it spread. His calves began to ache. His lower back tightened. He felt weak in a way that exercise fatigue simply did not account for. What was happening inside Robert's body was a condition called statin-induced myopathy. Muscle damage caused by elevated levels of the statin drug in his bloodstream, and the grapefruit juice his wife had been lovingly preparing for him every morning was making the problem dramatically worse by blocking the enzyme that should have been keeping the medication at a safe level. Statins are one of the most widely prescribed medications in the United States for adults over 60, and they are not alone. The list of medications that interact dangerously with grapefruit is long, and many seniors are genuinely shocked when they first hear it. Calcium channel blockers used for blood pressure and heart rhythm, including medications like felodipine, nifedipine, and amlodipine, are significantly affected. Certain statins, particularly simvastatin, lovastatin, and atorvastatin, carry serious interaction risks. Blood thinners, like certain formulations of anticoagulants, can be affected. Some anti-anxiety medications in the benzodiazepine family are impacted. Even certain immunosuppressant drugs and some medications used to treat irregular heart rhythm, including drugs like amiodarone, can reach dangerously elevated blood levels in the presence of grapefruit. What makes this particularly alarming for seniors is that the effect of grapefruit on these enzymes is not brief. Unlike food interactions that resolve quickly, grapefruit's blocking effect on CYP3A4 can last anywhere from 24 to 72 hours after consumption. That means even if you eat grapefruit in the morning and take your medication at night, the interaction is still very much happening inside your body. Doctors rarely explain this clearly. Most seniors who have been warned about grapefruit assume they simply need to avoid eating it at the same time as their pill. But that is not how this works. The window of risk is not measured in hours. It is measured in days. Helen was 74 and had always been what her family called the healthy one. She had managed to avoid the major medications that many of her friends were on for most of her 60s. But after a diagnosis of atrial fibrillation, a condition involving an irregular heart rhythm that significantly increases stroke risk, her cardiologist placed her on a medication to help regulate her heart rate. Helen was careful, diligent, and thorough. She read everything about her condition. She attended her follow-up appointments without fail. But nobody in that clinical process ever sat her down and gave her a clear, specific list of foods she needed to avoid with this new medication. They mentioned grapefruit briefly. She nodded. She thought she understood. She did not realize the depth of what they were actually warning her about. Several weeks later, Helen experienced a frightening episode. Her heart began racing in a way she had never felt before. She felt lightheaded, short of breath, and genuinely frightened. She was taken to the hospital where it was discovered that the drug levels in her blood were significantly elevated. Her care team worked to stabilize her, and when they pieced together her diet and her medication schedule, the grapefruit she had been consuming regularly emerged as the most likely contributor. She was fortunate. Not every senior in that situation walks away without lasting consequences. If there is one thing that Margaret, Robert, and Helen all had in common, it was this. They were all doing their very best. They were not careless people. They were not ignoring their doctors. They were not making reckless choices. They were simply missing one critical piece of information. And that missing piece had the potential to undo everything else they were doing right. That is the part of this story that matters most, and that is the part we want you to carry with you when this video ends. The most important lesson here is not simply avoid grapefruit. That is the surface. The deeper lesson is that food and medication interact inside your body in ways that are often invisible, gradual, and easily mistaken for something else entirely. When a senior begins feeling more fatigued than usual, or notices their heart behaving strangely, or develops muscle pain that seems to come out of nowhere, the last thing most of them think to ask is whether something in their diet is affecting their medication. And that instinct, the instinct to blame aging, to blame stress, to blame the natural passage of time, is exactly what allows these interactions to continue unaddressed for days, weeks, or even months. So here is what we want you to actually do with this information. First, look carefully at the list of medications you are currently taking. If you take any medication for blood pressure, heart rhythm, cholesterol, blood clotting, anxiety, or immune function, that medication may be on the list of drugs known to interact with grapefruit. The safest and most direct thing you can do is take that medication bottle. Call your pharmacist, not just your doctor's office, but your pharmacist specifically, because pharmacists are exceptionally well trained in drug interactions, and ask them directly, does grapefruit interact with any of my current medications? And if so, what does that mean for me? That single phone call could be one of the most important health conversations you have this year. Second, understand that the interaction is not limited to fresh grapefruit alone. Grapefruit juice carries the same furanocoumarins and produces the same enzyme-blocking effect. Some people who would never eat a grapefruit regularly drink grapefruit juice without thinking twice. Certain marmalades made from citrus can contain grapefruit compounds. Seville oranges, the bitter oranges commonly used in some commercial orange marmalades, and certain herbal supplements also contain similar compounds and can produce related effects. Tangelos, which are a hybrid of grapefruit and tangerine, have been flagged in some research as well. The safest position for anyone on a grapefruit interactive medication is to eliminate all of these from their diet entirely, unless a physician has specifically evaluated the situation and given individual guidance. Third, and perhaps most importantly, we want to talk about warning signs. Because some of you watching this today may have already been consuming grapefruit alongside medications that interact with it, and you may already be experiencing symptoms without realizing the connection. If you are on a calcium channel blocker and you have been feeling unusual dizziness, heart pounding or fluttering, swelling in your ankles, or a sense of warmth or flushing, please do not dismiss those feelings. If you are on a statin and you have developed muscle aches, tenderness, or weakness, particularly in your thighs, hips, or shoulders, please bring that up with your doctor immediately, because in rare but serious cases, elevated statin levels can lead to a dangerous breakdown of muscle tissue that affects the kidneys. If you are on any blood-thinning medication and you have noticed unusual bruising, bleeding that takes longer than usual to stop, or any unexplained bleeding, this is urgent. These are not things to wait on. The body is always communicating with us. That is something we say often on this channel, and we say it because it is one of the most important truths in all of medicine. Symptoms are information. Fatigue is information. Muscle pain is information. An irregular heartbeat is information. The body is not randomly malfunctioning. It is responding to something. And when you give yourself the knowledge to understand what those signals might mean, you become an active participant in your own health rather than a passive bystander watching things unfold. Many seniors carry a feeling, one that we hear about more than almost anything else, that they do not want to bother their doctor with small concerns. They do not want to seem alarmist. They do not want to seem difficult. They minimize. They wait. They tell themselves it will pass. And sometimes it does. But sometimes the thing they waited on was the thing that mattered most. Please do not let a concern about seeming overly cautious prevent you from asking a question that could protect your heart, your muscles, your kidneys, or your life. There is no such thing as a question too small when it comes to how your medications interact with what you put in your body every day. We also want to acknowledge something real. It can feel overwhelming to learn that even something as innocent and wholesome as a piece of fruit can cause problems. It can feel like yet another thing to worry about in a season of life that already carries its share of health concerns. We understand that, and we want you to hear this clearly. This is not about fear. This is about empowerment. Knowing this information puts you ahead. It makes you the person in your family who can share this with others. It makes you the person who catches something before it becomes a crisis. Knowledge is not a burden when it comes with clarity and a clear path forward. And that is exactly what we hope this video has given you today. If you have a parent, a sibling, a neighbor, a friend, or a spouse who is over 60 and taking heart or blood pressure medication, please share this video with them. Not because we want more views, but because this information could genuinely change the way they manage their health, and it might just prevent a frightening and entirely avoidable medical event. That is the whole reason this channel exists, from the entire team here at Healthy After 60. Thank you for trusting us with your time and with your health. Subscribe to Healthy After 60 for more health insights designed specifically for older adults, and we will see you in the next video.